He's a well-known heart surgeon, but also one of the founders of UofL's Cardiovascular Innovation Institute, CII, as those of us at UofL call it. He's Dr. Laman Gray, the endowed chair in cardiothoracic surgery at UofL. He's here to talk about what's going on at the CII and heart research. Laman, it's always good to see you.
It's a pleasure to be here, Mark.
How you been? You're still standing, still wandering around, aren't you?
I'm still doing great. I still enjoy what I'm doing.
Well,
Absolutely.
good. We should point out to folks that who may recognize your name but don't exactly know who you are that you did the first open heart surgery in Kentucky. And what year was that?
It wasn't quite the first open heart surgery.
Well, it was the first transplant, I guess,
did
right?
First heart transplant in Kentucky. Golly Moses, that was back in 84, I think it was. 83. No, 83 it was.
Yeah, I remember being a young reporter and doing stories on that.
Yeah, it was an exciting time. I'll never forget that.
That was kind of cool. All right, so we'll talk a little bit more about that here in a minute. But first of all, I want you to talk a little bit about what is CII? What is the Cardiovascular Innovation Institute?
Well, the Cardiovascular Innovation Institute is a institute that we set up in about 10 years ago or so. And really, the basis was we had a very large surgery program at Louisville as part of the university one at Jewish Hospital. And we wanted to expand the research program. So it originally started with some conversations that I had with Hank Wagner, who was the CEO at Jewish Hospital. And we wanted to start to really improve the academic aspect. And Hank said that Jewish Hospital would be willing to put in $20 million into a research institute. So the two of us went to talk to Jim Ramsey, who thought it was a really good idea. And that's really the very beginning.
That's how CII was born, huh?
That's how it was born.
So what do you do there? What do you do at the CII these days?
Well, we do cardiovascular research. And so let me sort of give you the basis of it. The basis of it is we wanted to do translational research. Now, what we mean by translational research is research that has a clinical problem. So I am a surgeon, not a basic researcher, so when we have a problem that we need to try to solve, we want to work with the basic scientists, the PhDs, and the other physicians, trying to get a solution to the problem. So that's what the basic concept of it is. It's a translational research. So we take the real problems we have, try to find solutions, and then move it into the clinical reality.
And get it into the bedside, into patients.
Absolutely.
Figure out how to help patients. So what are some of the things the CII, Cardiovascular Innovation Institute at UofL, is working on right now? What are some of the problems that you're trying to solve?
Well, okay, we're still working with trying to improve what we call ventricular assist devices in the total artificial hearts, which is really what my expertise is in. Mm-hmm. But there are other areas that I think are very, very exciting, and we're doing a lot of, I would call it stem cell research. And let me give you...
Is this Dr. Roberto Boli? Does he work with you guys?
Roberto works with us, too.
Okay.
We all work together. It's a very good team that works all together, absolutely. And to give you an example of what we're trying to do is when somebody has a heart attack, the heart muscle actually dies and becomes weak. And this is what people could die from, or they can go into heart failure from. So we're trying to develop cell-based techniques to strengthen the heart and to make it regrow, and so that we won't have to use these artificial hearts or stuff like that, trying to make the native heart stronger again.
And this is one of the most amazing things that I've discovered since I've worked at the University of Louisville and been doing stories on stuff going on at UofL, is this ability, apparently it's working in some patients at least, to take what's left of the good heart tissue, take it out and regenerate it and basically insert it back into the heart to grow brand new good heart tissue to replace the stuff that's been damaged by a heart attack, right?
That's exactly what we're working on in the lab.
And that's unbelievable. And you got some patients that it's actually worked in. I know Mike.
It has, but I'll be honest, it's harder than you think.
Well, it sounds super easy.
It isn't. It's far from it. But we're making really good progress in the area. But I'm afraid it's going to be another 20, 30 years before we really have the techniques perfected. But there's little question in my mind that in the future we will be able to take cells out of the body and manipulate them in the laboratory, then put the same cells back in and regenerate tissue that's healthy.
And in the meantime, these ventricular assist devices, they're not. It's not a whole heart. Kind of explain what that is to people. It just helps the heart, basically, right?
Sure. Well, a ventricular assist device is basically half of a total artificial heart. Now, your heart really has two parts. There's a right side and the left side of a heart. And the right side of the heart puts the blood through the lungs. The left side of the heart puts it through the rest of the body. And the left side of the heart is one that has to do most of the work. So the ventricular assist device just assists the left side of the heart, not the right side. So it's just half of a heart. And the left or ventricular assist device usually works probably in about 75% of the people. That's adequate because the left side of the heart is one that does the major work and has a strain on it. And if you can relieve that, it even makes the right side of the heart work better.
Talking to Dr. Laman Gray, who is with the University of Louisville. He's the chair in the Cardiothoracic Surgery Department, the endowed chair there. And we're talking about heart transplants and heart research and what's going on at the Cardiovascular Innovation Institute at UofL. I'm going to go for a couple more minutes here, and then we got to take a break. But one thing I want to ask you about the assist devices. How has the technology improved in the last 2, 3, 4, 5 years with those, or are you still using the technology from 10 years ago in those?
No, actually it's improved dramatically. One of the big examples is the size of these assist devices. When we originally started to use them, they were so large they actually had to sit outside the body. Then we moved them into electrical motors where we were able to implant them, and it was actually implanted in the abdomen, and they were still quite large. And today, they're centrifugal pumps and axial flow pumps that really are about the size of a D-cell battery, as a good example. And so they're quite small, and even some of them are smaller than a D-cell battery that will totally fit inside the chest. And these are electrical type of devices, and so they're easier to implant. The patient doesn't bother the patient that much, and they're very efficient and work very, very well. So there's been dramatic improvement in the technology over the last 20 or 30 years.
Where have all the full heart transplants gone? You don't hear about it anymore, that you're taking full hearts out of one guy, putting them in another guy. Why not?
Well, we're still doing heart transplants.
Okay, but there aren't that many of them, are there?
Well, it all depends. The biggest problem with numbers of heart transplants is the number of donors. In the entire U.S., there are only about 3,000 donors. So and that's per year. Mm-hmm. So they're just not a number. One of the problems is there are maybe 10,000 or 20,000 people that sick that could use heart transplant. So there's a terrible mismatch between the number of hearts available and what we can do to transplant them.
Okay, so that's the biggest problem.
It really is. And see, the hearts that can be transplanted usually have to come from younger people that are usually have some tragedies occurred where they've been in an accident or something like that.
Are Americans getting better taking care of their heart in the years that you've been doing this? Are less people? Are you getting less people and less patients that are smoking and doing all the bad things that are bad for your heart?
Well, actually, yes. Well, it's sort of exciting because if you look at the death rate from heart disease, it has decreased about 35% over the last 20 years. So less people are dying from heart disease, although heart disease still is the number one cause of death in the world. Mm-hmm. Most people do die from heart disease, more so than cancer or other things. But with the improvements in the treatment of cardiovascular disease, the death rate has definitely decreased and people are living longer. One of the biggest improvements is the use of statins, which decrease the cholesterol buildup in the blood vessels. And I think you combine that with the technologies of putting in the stents in the coronary arteries and the tremendous advancements that have happened in cardiac surgery, of all those factors have gone together to decrease the death rate.
Let me ask you this, and I forgot to ask a little bit earlier when we were talking about the heart assist devices. 3D printing. It's the wave of the future. They can make just about anything over in the Speed School of Engineering over here with these 3D printers. Is there going to be a time, you think, when we're going to be able to essentially manufacture a heart and stick it in somebody?
I doubt it, to be honest with you. There's certainly a lot of hype about that, but my gosh, the problems associated with it are staggering. It's not the 3D printing, and that's not the problem. That's, to be honest with you, that's sort of easy. The problem is getting the cells and the basic biology of cell biology, and it's truly just not realistic at this point in time. Now, we're doing 3D printing of cells at the CII, and it is an exciting area of research. And for instance, one thing we're doing with this is we're trying to make a patch that we can put on the heart to strengthen the muscle. And so what we do, we print a layer of cells, then we put a layer of cells that make vessels, then we put a layer of cell muscles, then we put more vessels. So yes, we do 3D printing, making a structure, but it's not what most people conceive of making a heart by 3D printing.
Right, it's
so,
a little bit different. You might be able to make skin or something like that,
absolutely.
but something as complex as a
Yes.
heart muscle, that's
it's
totally different story.
Exactly.
All right, so give me some reason for optimism about research on hearts that we can go forward from here. What would you tell folks about the CII and just research in general about hearts?
Well, I personally think the future is absolutely one of the most exciting things. I'll be honest, I wish I were 30 years old and starting now instead of, unfortunately, at the end of my career, because I think there's a huge amount of exciting stuff, and it goes in many different ways. We're now doing these for cardiac surgery. We're doing these surgeries much better. We're using minimally invasive techniques. We use new, smaller incisions. We don't use the robot much in cardiac surgery, but I do think, looking in the future, yes, that will be used more in that. And the instruments we're using are much more sophisticated than when I started 30 years ago. And so I think the future looks just absolutely bright and really exciting. And again, I wish I were able to start over.
Huh?
Yeah.
A young surgeon. All right, well, when you were a young surgeon, you were terrific, and you're still doing a great job down at the CII, and it's always great to talk to you, Dr. Laman Gray.
Well, my pleasure to be here, Mark,
right.
as always.